Welcome to Implementing the CDC Guidance, Considerations for Open or Reopening Childcare Programs. Today's webinar has been pre-recorded. Welcome. This webinar is offered by the Office of Child Development and Early Learning, the Bureau of Certification, and the Pennsylvania Key. We sincerely appreciate everything that you do every day to keep all kids and families safe and staff safe and healthy. Today's webinar recording will be posted on the PAKey's coronavirus webpage with the slides. The webinars are different in response to your questions, so please continue to email your questions to hssco@pakeys.org. To meet your needs, we need to hear your questions, so please continue to submit them. As counties move into the yellow and green phase, it is a local child care decision whether to reopen. We hope the information provided here and in other webinars help you to plan operations and make a decision that is right for your program. This is me. So today I will be highlighting portions, not all, of the supplemental guidance for child care programs that remain open, which is the guidance from the CDC. This guidance was published on April 21st, 2020. A special note regarding guidance is that many stakeholders are looking for the Department of Health or the Department of Human Services to issue guidance specific to Pennsylvania child care. The CDC is the most current and updated information relating to COVID-19. As the CDC learns more about the virus, this guidance is the most trusted source of information. In addition to the supports available through the Departments of Health and Human Services, OCDEL also is being advised by public health experts from the Children's Hospital of Philadelphia, better known as CHOP, a group of pediatricians and members of the PA chapter of the American Academy of Pediatrics, and health experts experienced in child health consultation and technical assistance. The purpose of the webinar is to clarify the practices described in the CDC guidance, to describe how the guidance may be implemented to keep children, staff, and parents safe and healthy, and to address your questions. This is the position of the Bureau of Certification. The Bureau of Certification is recommending child care providers follow the CDC guidance to the best of their ability. The CDC guidance describes what programs should do. Child care operators considering reopening must familiarize themselves with the CDC guidance. Please see this document, Phased-in Approach to Reopen Business, What It Means for Child Care Programs, published by OCDEL in an announcement on May 2nd, 2020. It's important when you're implementing the guidance, of course, to be communicating with families frequently about what is going on in your program. You need to update emergency contact information and, of course, explain your new policies and procedures, of which there are many, and to offer ways to communicate virtually with families. Virtually is the way to go now, right? So thinking about reaching out to families through FaceTime or Zoom or Google Duo, all the various applications is really helpful, as well as texting, of course, and email. It's important to check in with families on a regular basis. Everyone's well-being is of the utmost importance right now. It's important to share community resources with them and access to services, food banks, access to healthcare. It's really important to keep children up to date on their immunizations and their well child visits. Prevention is always best, so our children are healthy and ready to learn. So we want to encourage parents to make sure that they're taking their child to the doctor's office to get their immunizations and to be up to date. So, what do we know about COVID so far? In general, the worldwide research and data trends show these points. Children are not super spreaders of COVID-19, unlike other viruses such as influenza and measles. Initially, we thought they were, but they are not. It turns out that they get infected less and spread COVID-19 less than older individuals. Children get milder illness than adults, and in most cases, children are infected usually from clusters in families and usually from adults. So these are the take-home messages from the current research, which shows these data trends and how children transmit COVID-19 and how they get infected. This should be reassuring for the group childcare setting. Though it's not as safe as staying at home, the childcare setting is not the worst place to be. The biggest risk to childcare providers are other adults, other childcare providers, and not the children. Children are much more likely to get infected from adults. And when children are infected, they spread the disease at very low rates to other children. This is the most current update for families in need of childcare, which covers frequently asked questions. It was published by the Department of Human Services on June 1st, 2020. In general, we know that most transmission of the coronavirus happens face-to-face between adults, so all staff should wear cloth-based coverings when providing childcare. According to the CDC guidance for childcare programs that remain open, when children are able to wear masks effectively and manage that effectively, it is still recommended that children wear masks, but it is not required. The CDC guidance represents the best information we have to keep children and the adults that care for them safe. However, they are not part of the PA childcare regulations. Although it is recommended that children over 2 wear a mask when feasible, it is not required. But we encourage both childcare providers and families to have a conversation about their concerns around this, around the level of risk that everyone perceives and what those actual risks are, and to come up with a strategy around masks that everyone understands and feels more comfortable with. So today's webinar is going to focus on some topics which have really been frequently asked questions that have come into our hssco@pakeys.org email. So we're going to cover these topics: exclusion and return to care, guidance on doctors' letters and notes, summertime safety during COVID-19, including outdoor activities, water planes, swimming, transporting children, and families with regards to domestic and international travel. So let's start with the PA childcare regulations around exclusion and return to care. What do the PA childcare regulations say about communicable diseases such as COVID-19, exclusion, and doctor's notes for return to care? Well, let's take a look at the regulations. This is 3270.137, children with symptoms of disease. An operator who observes an enrolled child with symptoms of a communicable disease or infection that can be transmitted directly or indirectly and which may threaten the health of children in care shall exclude the child from attendance until the operator receives notification from a physician or a certified registered nurse practitioner that the child is no longer considered a threat to the health of others. The notification shall be retained in the child's file. The list of diseases and conditions specified in the code are relating to communicable and non-communicable diseases are found at the Department of Health. This is 3270.153, facility persons with symptoms of disease. Essentially, this says exactly what the previous regulation states, except that it talks about a facility person, which would probably be a staff member, a caregiver, provider, practitioner in a childcare setting. So it follows exactly the same requirements as the previous regulation. So a lot of questions have come in about returning to care or work as a result of COVID-19 and the concerns around this communicable disease. So some of the questions around doctor's letters and notes that have come in are regarding what is acceptable notification. These are the acceptable notification methods for return to care or work. An operator can receive a signed letter or note on letterhead by fax. A letter or note on letterhead or a document with identifying information may be emailed as an attachment to the operator. A letter or note with identifying information may be typed into the body of an email to the operator. A smartphone photo of the letter or note with identifying information may be texted or emailed to the operator. So these are options for the method to receive notification from the healthcare provider that a child can return to care or a staff member may return to work. These are virtual methods, many of them obviously, so the Bureau of Certification has agreed that it is appropriate to accept these virtual methods. It's important to retain the notification. That's required, of course. Retaining the notification is in the regulation. If the child has a paper file, the operator should print out the virtual documentation that they've received from the healthcare provider and insert it into the child's file or record. If the child's records are kept digitally on a computer, the operator may save the photo, the email, etc., and put it into the child's digital file. So it's important, though, for us to think about some of these situations when children have been excluded that aren't related to COVID-19, because we know that it's possible that fever could be a symptom of something else going on, such as just a regular cold or an ear infection, for example. So we don't want to jump to conclusions. We're not diagnosing anyone based on symptoms alone. So it's important first to take a look at the PA code and follow the regulations. So what about fever? For a child or a staff that's not been tested for COVID-19, refer to the PA code for the existing licensing regs on exclusion and the return to care criteria. The PA code does suggest exclusion for fever here at this link. The code is not specific as to when to return to care, except for infants under 4 months of age, and it states when fever is resolved or judged to be non-infective. But the best practice to follow is to follow the return to care for fever under Caring for Our Children, which is at nrckids.org. Caring for Our Children has guidance for fever under influenza management at this link, and it states we should allow children and staff who have been excluded for fever or respiratory symptoms and fever to return once the fever has resolved for 24 hours with no fever-reducing medications. And in this situation, no note is required for return to care for a fever alone or mild respiratory symptoms which has resolved in 24 hours with no fever-reducing medication. What about a cough? Very commonly, a child might arrive with a cough and/or a runny nose, mild respiratory symptoms. The child is behaving normally, they don't have any fever. It's not recommended to test them or exclude them. This is consistent with the PA code and with caring for our children, considered to be best practice. And we all know if we kept children out of childcare for runny noses, we might never see them again. What about a potential exposure to COVID-19? A potential exposure means being a household contact or having close contact within 6 feet of an individual with confirmed or suspected COVID-19 for at least 15 minutes. This has been updated. It used to be 10, now it's 15. So I wanted to point that out. The time frame for having contact with an individual includes the period of time of 48 hours before the individual became symptomatic. It's important that you report COVID-19 if there is a positive case in a child or adult who has been present in the child care facility. You must call the Pennsylvania Department of Health at 1-877-724-3258 to get further instruction. Also, you must inform OCDEL by contacting the appropriate regional office of certification. I'm going to go through some of the CDC guidance on returning to care if a person has COVID-19. If a child or staff has COVID-19, you need to be checking this link to the CDC regulations or to the recommendations, excuse me. How to discontinue home isolation. If the person is not tested to determine if they're still contagious, they can leave home after these 3 things have happened. No fever for at least 72 hours. That's 3 full days of no fever without the use of medicine that reduces fevers. And other symptoms have improved. For example, when the cough or shortness of breath has improved, and at least 10 days have passed since symptoms first appeared. This is the CDC guidance for people who have been tested. If tested to determine if the person is still contagious, they can leave home after these 3 things have happened. They no longer have a fever without the use of medicine that reduces fevers, and other symptoms have improved. For example, when cough or shortness of breath has improved, and the person received 2 negative tests in a row at least 24 hours apart, and the doctor will follow the CDC guidelines for this. Now let's move into some topics around summertime safety during COVID-19. We want to address these summertime considerations. A lot of questions have come to us around these topics of outdoor activities, water play, swimming, transporting children, and domestic and international travel. Well, why do we want to go outside more? That's the main question. We do want to be making outdoor play a priority during COVID-19. There are many benefits, of course, to outdoor play, but with the virus, more circulation, more air, more ventilation is going to lower the risk of transmission. It's also easier to physical distance when we're in open outdoor spaces. And movement activities that we know support brain development, early learning, and emotional well-being. And everyone who is more active is healthier. So there's lots of reasons why we want to make outdoor activities a priority. There are some general guidance for outdoor activities around playground safety. Of course, it's important to have more supervision. Active supervision is required, especially during outdoor activities. It's important to stagger each group on the playground so they're not mixing. Keep the groups intact. And when standing in line or getting ready to go outside, it's important to use your 6 feet distancing. And if at all possible, of course, with children, we know that that may not be possible all the time, but at least we're intentionally thinking about it. Also, no congregating. What does that mean? Well, kids can congregate around certain climbing structures. We want to be aware of that. They could congregate around shade stations or water stations, around picnics, and around water activities outside. So it's important that we provide multiple shade and water stations to thin out the crowd, so to speak, to avoid the crowding and congregating or waiting in line. What about cleaning and disinfecting? Well, it's important in general, as we know, to routinely wipe down those frequently touched surfaces with an EPA-registered disinfectant. If surfaces are visibly soiled, they should first be cleaned with a cloth soaked in hot soapy water. And also, every child and adult should be required to hand wash after coming inside from being outdoors and having outdoor activities. These are some of the items that we need to think about around our cleaning and disinfecting on a routine basis. Recently, the CDC has been updating their frequently asked questions online for cleaning and disinfection. So I've included the link to that. It's very helpful. They are staying up to date on this. So we recommend that you take a look at this for guidance. In general, for outdoor areas, it says under the CDC frequently asked questions, there should be routine cleaning. High-touch surfaces made of plastic or metal. Plastic or metal surfaces are actually where the virus can live the longest for 3 full days. So it's important that we do routine cleaning and disinfection of these areas, such as grab bars and railings. They need to be cleaned and sanitized routinely. The cleaning and disinfection of wooden surfaces, such as play structures, benches, and tables, or ground cover like mulch or sand, is not recommended. Spraying disinfectant on outdoor playgrounds is not an efficient use of the disinfectant supplies that are usually in short order and has not been proven to reduce the risk of COVID-19. So it's recommended that you clean and wipe down plastic or metal grab bars and railings that are used frequently by children with a disinfectant at least 1 time a day. What about cleaning and disinfecting porous surfaces? This is a little bit different. Examples of this would be interlocking mats for babies and toddlers that are on the floor in classrooms, settings like that. Also wood blocks for play. What do we do about these surfaces? How do we clean and disinfect them? Well, first of all, the porous surfaces cannot be submerged in water or soaked in cleaning solutions. That's not recommended. First, we need to wipe the surface with a cloth that has been soaked in hot soapy water, and be careful not to saturate. Our goal is to remove any debris. Then we can use a scrub brush or a toothbrush, for example, to remove any dirt or grime from grooves. We can allow it to dry completely after that. Then we would wipe with a fresh cloth that's been soaked in an EPA-registered non-toxic disinfectant prepared to the manufacturer's recommendations. Allow the solution to remain on the surface for the manufacturer's recommended time. And note, when a disinfectant is used for the first time, it's important to do a spot test to ensure that the solution will not discolor whatever it is that we're trying to disinfect, and that's especially important for mats. Then we would wipe down with a fresh cloth that's been rinsed with clean water to remove any residual disinfectant, and then allow it to air dry completely. It's important to disinfect these items when they come into contact with blood, feces, vomit, urine, or any other bodily fluids. These are the lists of the effective disinfectants against coronavirus. They're approved, and I've included the links to them. This Center for Biocide Chemistries is keeping their list of products by brand name and manufacturer. It might be easier for people to locate the solution in this list, and they keep it updated regularly. A lot of questions have come in about sandboxes. Is it okay to use sandboxes? Well, previously I mentioned it's not necessary to disinfect the sand in the sandboxes. It's not recommended. But if children are using sandboxes, of course, we're thinking ahead of time how to maintain that 6 feet physical distancing between children and to limit the number of children at one time that are in the sandbox. So that's a consideration. What about water play? Well, we encourage water play, of course, with active supervision. Water play tables are very exciting for kids and very popular. It's important to have an individual table for each child and no sharing of the water tables during COVID-19. So this is recommended that they all have their individual table. What about water sprinklers? Of course, thinking about, again, avoiding waiting in line and congregating around the sprinklers. Important to maintain the 6 feet physical distancing if at all possible. So this requires a lot of active supervision. But the sprinklers are a great way for kids, obviously, to have fun and be safe around water. There's been questions about guidance for swimming pools. As we know, drowning is the #1 cause of death in children age 1 to 4. So active supervision is absolutely essential. You cannot let a child out of your vision, out of your eyesight for more than like a second, because this is very dangerous. So there were some concerns around childcare programs taking children to private pools. This is tempting if public pools are closed. And in certain urban areas, there are requirements around closing public pools right now. So it's possible childcare providers may want to take kids to private pools, but it's really important to have even more supervision in those settings because they're not set up for large groups of people or for the public. If you are taking kids to public pools, it's important to check those places out first before you take children there to make sure that everything is set up properly so that you can maintain intact groupings and practice physical distancing. For example, having those shade areas, again, spaced out, stations, places where children can sit and be in the shaded areas around the pool are important. But no congregating in or outside the pool and no cloth face coverings in the water. There have been questions around parks and field trips. Field trips are not recommended. It is very difficult to follow the 6 feet physical distancing on a field trip, as you can imagine. Usually field trips involve very large groups, mixing of groups, and crowded parking lots. These are all things that we want to avoid. So we do not recommend field trips. Also, transporting groups of children is problematic. because you have to maintain your physical distancing, and there's a lot of safety issues with that. I've provided the link to the state parks here so that you can check that out, which ones are open and less crowded, and perhaps call ahead and make sure that it would be appropriate for you to bring young children into those settings. Again, avoiding crowded parking and picnic areas and trailheads is really important. So this is going to require a lot of planning ahead of time. If you're traveling by car, van, or bus, you need to be maintaining physical distancing. And adults, of course, should be wearing masks during that time when they're in the vehicle. You have to remember that this is a restricted space indoors. It's inside a vehicle. So the transmission of the virus is more likely in a restricted space like that. And especially if you're traveling a long distance, it's going to increase your risk of transmission. So anytime that you're in a car or vehicle, it's going to increase the risk of transmission of the coronavirus. Important to seat children, one child per row, and to skip rows when possible. What about sunscreen? What's the proper safe application of sunscreen? It's important to use sunscreen lotion or pump mechanisms rather than the aerosol sprays, because the aerosol sprays tend to cover a large area, and they can get into kids' eyes, into their mouth and nose. So we want to avoid that. Do not use the aerosol sprays. Use the lotion or pump. The sunscreen may be applied to skin without gloves. A lot of questions have come in about that. It's not necessary to wear gloves if you're touching a child's skin. So the sunscreen may be applied that way with ungloved hands, and you need to hand wash between each application to avoid skin irritation. We know that most children have been given a prescription or guidance to which lotion they should be applying. So we don't want to have any allergies or sun irritations on the skin as a result of sharing those lotions or solutions. So it's important to hand wash between each application to avoid that. A lot of questions about travel have come in. So if families are traveling within Pennsylvania, this comes directly from the PA Department of Health Summer Program Frequently Asked Question document. Question: if a summer program is planning operations in a county that is in the yellow or green phase, must they restrict enrollment to only children residing in counties with similar designations? The answer to this is no. There are no restrictions limiting enrollments based on the designation of where children reside and enrollment in the summer program activities. What about families that are traveling into Pennsylvania from other states? Children should not be automatically excluded from childcare if they're crossing state boundaries. At this time, this is the guidance. No exclusion from childcare if the family is coming into PA from outside the state or locality. So currently, this is what we would be following. No need to just automatically exclude a child based on where they're coming in from out of state. Guidance for international travel is different, though. The CDC guidance is here at this link. For any individual who travels internationally and returns to the United States, that individual should follow a 14-day quarantine period. Just a few don'ts during COVID-19. We're not doing toothbrushing in the program during COVID-19 due to the transmission risk of the virus with the toothbrushing and being in close proximity to kids at the sink or at the table when they're brushing. So this is avoided. Do not do toothbrushing, and we shouldn't be using nebulizer treatments, because the nebulizer can increase the risk of aerosolized virus coming into the air. If you're looking for more resources about the coronavirus, please check out the Pennsylvania Key Coronavirus Resource page. Also, if you want to look very closely at the CDC guidance, which we recommend, take a look at the guidance at this link that's provided. Today's webinar recording, slides, and the guidance are posted on the PAQs coronavirus web pages. Future webinar topics are new and will be pre-recorded and posted with the slides. Thank you so much for listening, and please email your questions or comments to this email. If something hasn't been covered that you need addressed, please feel free to email your question and ask for us to address it. And OCDEL is committed to reviewing and addressing all questions to the best of its ability. So thank you again, and please stay safe and healthy. Thank you.